Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Hilium Space edition or series. This audio podcast as part of a calibrated morphology, calibrated morphology. This audio podcast as part of a Storm Robotics production. So, in around in is this audio podcast as part of this series, some in this audio podcast a little bit around some of the research perspectives around hematuria. So hematuria is an important pathological finding and thus is included in sort of the criteria around chronic kidney disease. However, its presence is not usually mentioned in sort of epidemiological investigations when compared with proteinuria. For example, and most investigations in the field of acute kidney injury (AKI) do not focus on the role of hematuria. A few investigations have described hematuria-associated acute kidney injury in certain clinical settings, for example, IgA nephropathy, and or warfarin anticoagulant induced nephropathy. But it is difficult to apply these data directly to subjects with a high risk of acute kidney injury. A sort of investigation has demonstrated the associations of hematuria with both AKI and mortality in an intensive care unit patient population, but concluded that further clinical and experimental investigations were required to delineate the role of hematuria in AKI. Other nephrology and urology sort of research has informed that there should be more pathways to point of care testing or POCT to identify hematuria and proteinuria because of the long term complexities. Evidence from the majority of investigations studies that suggest that urinary dipstick investigations may provide a moderately useful indicator of the presence of hematuria. So, for example, a positive urinary dipstick test is reasonably or probable to represent the presence of hematuria to an extent, and this can be used in a primary care environment, in a primary care or sort of general practice environment. However, the context in which the urinary dipstick investigation is utilized warrants particular consideration. Research also indicates that the simple detection of microhematuria investigation for the presence of significant underlying pathology physiological or physiological are sort of pre sort of predispositions. The absence of hematuria on a single urinary dipstick investigation cannot reasonably be used to rule out symptomatic patients from further examination. However, there's little or no data, or have been little or no data sort of retrospectively on the association between repeat positive investigations for hematuria and the presence of disease. So the usefulness of the urinary dipstick investigation in this context remains problematic. There are relatively a few trial-based data regarding the effectiveness of screening for hematuria in the general population to identify life-threatening pathologies. Confirmation of hematuria using microscopy remains a valid option where further investigations are being considered. Stored samples for example, that are theoretically subject to degradation. The practice of sending urine samples, for example, taken in community for laboratory analysis of hematuria appears to be of questionable basis. Although such samples may still be useful to eliminate urinary tract infection as a cause of hematuria. Awareness sort of initiatives in around public and medical communities can help to delay and perhaps even preclude the development of chronic kidney disease, or CKD. And one such example of raising CKD awareness sort of generally has been through social media and the work around the Renal Patient Support Group, the RPSG. In many cases of CKD are left unrecognized, but the condition can be treated even at late stages. So POCT, point of care testing, is and would be advantageous. That draws this audio podcast to a close. This audio podcast is part of the Hilium Space edition or series. This audio podcast as part of a Calibrated Morphology. This audio podcast as part of a Storm Robotics production.